Hi, I'm Dr. Mayur, and today we are covering Botox 101, how it works, how long it lasts, and other top questions and queries that you have. By the end of this video, you will understand what to expect from your treatments, how to plan your treatments, and how to get the best and most natural results. So let's dive in. Botox is one of the most commonly performed cosmetic procedures worldwide, about 70 lakh procedures being done every year. Most of my patients love Botox because it gives amazing results. It smoothens wrinkle lines and gives a very refreshed look, and all of this as a lunch hour procedure. But how long do these results last, and how do you make them stretch that extra mile? All of this, as well as your common queries like side effects like bruising and resistance, as well as how will we get that natural look and prevent any kind of unevenness. Let's talk about all of this in this video. So Botox is derived from a naturally occurring neurotoxin which is produced by a bacterium. So it is basically a protein. When we inject it into any kind of muscle, the nerve that signals the muscle to contract is blocked. This prevents the muscle from contracting and prevents any wrinkle that's caused by that muscle to appear on the skin. It's not a filler. There's no gel being injected under the skin. We're just targeting a specific muscle and preventing the wrinkles caused by this muscle to form on the skin. To understand how Botox works, think of your forehead. Usually we have these forehead wrinkles that become more exaggerated when we lift up our eyebrows. And this is because of the frontalis muscle that runs from the brow to the forehead, just beyond the hairline. And these wrinkles keep increasing in depth and they also remain at rest. These are called as static wrinkles. So when Botox is injected into the frontalis, the repeated creasing completely disappears and you get a very smooth forehead. When you start seeing the effects of Botox, the first 1 to 3 days you won't see anything, but you can feel the muscles relaxing. The actual result of a Botox starts to be seen only after 1 week to 10 days, wherein the creases start to fade away. And the peak results are usually within 2 to 4 months. However, after 6 months, the results begin to wear off, the creases start to come back, and then it's time to get a Botox done again. How safe is Botox? Now, Botox is a tried and tested procedure. It has about 30 years of scientific research and data. There are a few side effects of Botox, such as itching, redness, and sometimes if it's overdone, a patient may develop a droopy eyelid or maybe even asymmetry in the face. So it's very important that Botox shouldn't be overdone and it should be done by a trained and experienced injector. It's important to follow a consistent schedule. So it's important to make sure that you plan your appointments every 3 to 4 months. Botox done regularly helps to relax the muscles for a longer time. Aftercare. For the first 7 days, it's important to avoid any kind of massaging. It's important to avoid any kind of strength training or any kind of brisk cardio. It's important to avoid any kind of sun exposure. So wear a good sunscreen and use a good moisturizer to keep your skin healthy as well as prolong the effect of Botox. And of course, it's important to maintain a healthy lifestyle, stay hydrated, eat nutrient-rich food, and get enough sleep, that is about 6 to 8 hours of sleep. Your skin and muscles perform better when they are well nourished and well hydrated. It's very common for us to do Botox and fillers together because Botox helps to smoothen those skin creases while fillers improve the volume, and thus you get an overall rejuvenated look. A combination of Botox and fillers gives a well-balanced and refreshed look. So if you are interested, speak to your injector and they'll map out which areas need what. There is a chance that after a Botox, you may have an uneven result. That is why at our clinic, we make sure that we underdo the procedure, which means that we under-inject. After a week's time, we reassess you and see if you need some more. This prevents any kind of asymmetry, prevents complications like droopy eyelid, and prevents dragging of the face to one side. So if you have any concerns, you should feel free to speak to your injector. We follow this protocol because your safety and your satisfaction comes first. If you found this video helpful, then hit like, subscribe, and ring the bell icon for more medically accurate videos. I'll see you in the next video.